So thank you very much. And this is Alejandro de la Parte from the University of Zaragoza. And first of all, we will thank to the scientific committee for the acceptance of this work entitled Sports and Dentistry, the Oral Health of Light and High Performance Aragonese Skiers. This is the sequence of our presentation consisting of introduction, objectives, methods, results, discussion, and conclusion. Well, first of all, the introduction, we can indicate that in this work, we try to get into two sciences that complement each other, like health and sport, because we cannot understand the health without the presence of sport, and the sport cannot be conceived without the presence of the health. As we know, the basis of sports science lies in the studies of physical activity and sport science, whose main objective is for the athlete to achieve maximum sports performance. And due to the great interest that has occurred in recent times for this sport, we have different health disciplines whose has been incorporated into the field of sport, such as medicine, psychology, nutrition, or physiotherapy. And what about the dentistry? If we conduct a literature review, we verify that there is a general lack of knowledge about the sports dentistry, although the oral health and sports performance have been related. This is why oral health could have a relevant role in the sport. Because no one doubts that health is essential for any sports person, if we know that the oral health is a part of the global health, we can indicate that the oral pathologies can affect the state of health. Our objective of this work is to evaluate the oral health status of professional skiers and high performance in autonomous community of Aragon. Aragon is our region and one of the 17 regions of Spain and one of the principal regions of winter sports due to the Pyrenees, highlighted among other sports like skiing. So to carry out this investigation, this epidemiological and descriptive study, the necessary steps were taken to have the approval of the Aragon Ethical Committee and to be able to carry out the oral examinations at the Aragon Sports Medicine Center. And in this study, a total of 18 Aragon skills have been explored, of which 11 were men and 7. The average age is 24 years. 61% belong to the male gender and the 14% to the female gender. If we see the dentition of skills, we can see that it presents 29 teeth, whose 25 are healthy, 1 decayed, 2 missing, and 2 treated. If we check the gingival situation, we can value that 55% of skills present gingivitis. About the use of a protective ferrula, the 22% of skills use that, and 45% indicates having suffered some trauma. About the brushings, we can see that it's present in 77% and 16 of skills need immediately odontological assistance due to an infectious process, pain, etc. And the skills go to the dentist every 16 months. The result we can see that we compare the use of a protective ferrula, splinted mouth aragonese skirts, in 22%, with the players of the hogh hockey club in 33%. All of them results were very far from the 85% reflected in the US in winter at least. If we observe the gingival bleeding, we verify that 88% of skirts present against 40% of the adult Spanish population. And 16% of skirts need immediate assistance, denoted the importance of the dental services. And if we compare the last visit to the dentist, skirts go on average every 16 months, very far from the recommended 12 months on average, and that 76% of the Spanish population complies. In this work, conclusion, we can that the elite aragonese skirts do not show a great number of dental pathologies. It is necessary to pay more attention to the sportsman or a health to improve their general health, quality of life, and the possible consequences it may have in their performance. And the dentist should actively participate in assessing the health status of sports person. So, thank you very much.